as more scientific research has been done, we're seeing that the lactulose test is not very accurate. So let me make this case. A 2020 meta-analysis looked at 25 studies. And across these 25 studies, 6,500 patients were examined, some of which had symptoms, some of which were healthy controls. Because remember, it's really important that we determine how accurate a test is in discriminating someone with symptoms or some sort of illness as compared to a healthy control. Because if not, then what ends up happening is almost everyone you test has the thing. And this is an inaccurate test. And so this is why studies just like this meta-analysis are performed. So we can see now that, again, there's 25 individual trials investigating this, what is the summary across these studies? And the results are fairly shocking and have really swayed the way I think about the lactulose test for SIBO. Now, again, they took those with IBS and they compared those to healthy controls, those who had no symptoms. They found a 36% positivity rate for SIBO in the IBS group and a 30% positivity in the healthy control group. So this is not a very good job of delineating between those who have symptoms and those who don't. It's almost identical, 30 to 36. If you double click on these results, what you see is that when using the lactulose test, healthy individuals had a 34% likelihood of having SIBO. If you used, conversely, the glucose test, only 4% of individuals were positive. So what this tells us is that the lactulose test shows a positivity rate in normal, healthy people that is nearly identical to those who have the symptoms of IBS. Or said another way, the lactulose test does not do an adequate job of telling us who has a problem and who doesn't, because the positivity rate between those with SIBO and those who are healthy is nearly identical. Okay, so said simply, you should not use the lactulose test. We have enough data now that clearly answers this question. What we find when we compare results, looking at those who are healthy and are given a SIBO test and those who have the symptoms of gas, bloating, diarrhea, abdominal pain, food reactivity, we find that the positivity rate with lactulose is essentially identical. So healthy people are showing SIBO just as commonly as people who have food reactivity, bloating, indigestion, constipation, diarrhea. Therefore, it's really not an accurate test, and I don't think we can any longer recommend using this test. Now, the one caveat, the one point in defense of the lactulose test would be if you use more contemporary and up-to-date interpretation guidelines. Right? You probably heard, well, the lactulose test or any test has to be interpreted correctly. And that's a fair, in my opinion, sort of retort. However, there is one study that examined this, again, giving the lactulose test, but using a more conservative diagnostic criteria known as the North American Consensus. But yet again, they found the same thing. The positivity rate for SIBO was nearly exactly the same in those with active symptoms versus healthy controls. So said really simply, many people who use a lactulose test will be told they have SIBO who do not. And because of that, I no longer support use of the SIBO breath test that is lactulose. So mistake number one is getting a lactulose breath test.